Hi doctors, my name is Dr. Lama and the topic today is orthopnea. The orthopnea is shortening of breath, the dyspnea, which occurs when lying flat, causing the person to have to sleep propped up in bed or sitting in a chair. Application in medicine. Orthopnea is usually a later manifestation of heart failure than in exertional dyspnea. It results from the redistribution of fluid from the spine circulation and lower extremities into the central circulation during recommency, with a result increase in pulmonary capillary pressure. Orthopnea in congestive heart failure. Although orthopnea is a relatively specific symptom of heart failure, it may occur in patients with abdominal obesity or ascites, and in patients with pulmonary disease whose lung mechanics favor an upright posture.
Chronic heart failure, patient outcomes for acutely decompensated disease have not improved. Across Canada, patients hospitalized for heart failure continue to suffer frequent complications, and 16.5% die during their initial hospitalization. An examination of the pathophysiology of acute decompensated heart failure identifies promising new avenues for treatment. During heart failure, the heart cannot circulate enough blood at normal cardiac filling pressures to meet the metabolic needs of the brain, kidneys, heart, and other vital organs. The body responds by releasing neurohormones. Certain neurohormones help maintain blood pressure, but over time, they cause heart failure to worsen. One of these neurohormones is renin, released by the kidneys in response to decreased perfusion and increased sympathetic activity. Renin activates the renin-angiotensin-aldosterone system, or RAAS, by cleaving angiotensinogen in the liver to produce angiotensin-1, which is further converted to angiotensin-2 in the lungs. Angiotensin-2 binds to blood vessel walls, causing vasoconstriction. Angiotensin-2 also stimulates release of endothelin from endothelial cells. Angiotensin-2 and endothelin act on vascular smooth muscle, causing constriction of the coronary arteries and systemic arteries and veins. While vasoconstriction helps maintain blood pressure, it can also have maladaptive effects. For example, the weakened heart must pump harder against increased resistance in the systemic arteries.
Causes of orthopnea. Orthopnea is due to increased distribution of blood to the pulmonary circulation, well recommended, but usually can be attributed to a more fundamental cause. Orthopnea is often a symptom of left ventricular heart failure and pulmonary edema. It can also occur in those with asthma and chronic bronchitis, as well as those with sleep apnea or panic disorder. How asthma causes a shortening in breath? Orthopnea is caused by accumulation of too much fluid in the lungs. In this video, explain how asthma causes a shortness of breath.
Asthma is a condition characterized by breathlessness and wheezing. To understand how asthma causes shortness of breath, one must look at the normal respiratory system. Air enters the lungs through a large tube known as the trachea, which is supported by concentric rings of cartilage connected to each other by annular ligaments. The trachea splits into a right and left primary bronchus, and from there, each primary bronchus subdivides into secondary and tertiary bronchi. Tertiary bronchi continue to branch into smaller tubes called bronchioles. Unlike the larger tubes, bronchioles do not contain cartilage and must rely on smooth muscle in their walls to keep these airways open. The smallest and final branch of bronchioles, called terminal bronchioles, end blindly into the alveolar sacs. Alveolar sacs are made up of grape-like clusters of alveoli. Within these alveoli, gas is exchanged and vital oxygen enters the bloodstream. Throughout the bronchiolar tree, mucus is secreted from specialized cells in the walls to trap foreign particles and irritants that may be in the air we breathe. The walls consist of cells that are covered with cilia, whose main role is to push mucus up and out of the bronchiolar tree, disposing of the trapped particles and irritants. Looking at a cross-section of a bronchiole, it is evident that under normal conditions, there is little resistance offered to the incoming rush of inspired air. The wall of the bronchiole is relaxed and provides an open airway. Asthma is a chronic condition in which various irritants cause bronchioles to become inflamed. Some of the most common irritants are dust mites, pollen, smoke, stress, and infections. These irritants can cause a cascade of events, such as the release of leukotrienes and histamine from leukocytes and mast cells. The result is inflammation, overproduction of mucus, and bronchial constriction. All three block the airways, making it difficult for air to move in the lungs and thus triggering an asthmatic attack. There are several treatments for asthma. The most common is epinephrine and related compounds.
In a prone position, blood volume from the feet and legs distributes to the lungs, which doesn't cause a problem for people whose hearts are pumping normally. However, in people with heart failure, excess blood in the lungs can cause breathing problems or shortness of breath. It should apply in Ecuador. Fluid overload treatment. In excess fluid is causing breathing problems like orthopnea. Doctors may recommend that the patient eat a low sodium diet because too much sodium can contribute to fluid overload. They might also prescribe diuretics, medicine that help the body eliminate excess sodium and water. If this medicine don't work to relieve the fluid overload, doctors may prescribe a procedure known as ultrafiltration, in which blood is passed through a small machine that filters out the excess fluid.
Ultrafiltration is a common membrane-based fluid treatment process utilizing a membrane with pore sizes ranging from 0.005 to 0.1 micron. Particles or macromolecules such as emulsified oils, metal hydroxides, proteins, starches, and suspended solids are retained on the feed side of the membrane, while molecules smaller than the selective membrane pores, such as water, alcohol, salt, and sugars, pass freely. This filtrate is often referred to as permeate. Examples of this are paper coating recovery, bacteria and virus removal from drinking water, and removal of suspended solids and fibrous material from streams such as whitewater in the pulp and paper industry.